Hi, my name is Ana Luz Hernandez, and I am currently a patient of Betsy Portugal's through UMC's midwifery program. I am currently at week 34, so towards the very end of my pregnancy in the last trimester, and the focus of today's video diary is on the creation of a birth plan. If you're a first-time mom, the creation of a birth plan does help give you some kind of reassurance in terms of providing a structure on how your experience will play out. But of course, as we all know, there's only so many things that you can plan for. Having said that, I know that for women such as myself that are going down the route of having a natural and unmedicated childbirth, we don't know what our pain threshold will look like. We don't know how many hours we'll be in labor. We don't know if it will be easy to have the child or if it'll, take us a little bit longer and be extremely hard for us to have that experience. When I went to go see Betsy, we talked about the birth plan and making sure that I'm not hooked up to any IV, making sure that if I am hooked up to a monitor, it's only for periodic checkup. And I'm hoping that this time around I will maybe take it a little bit easier, not be so focused on moving, but allowing my body to rest, because when I had my son, I was very exhausted from all the movement, and I feel much more confident moving forward that I can manage the pain since I've already done it before, and I am just hoping that the labor experience won't be as long with my daughter as it was with my son. And so now I am looking forward to taking a pain management course with UMC, just as a refresher, just to make sure that I am on track.
When you're developing your birth plan, I like to consider it more of a communication tool to me, to the members of the healthcare team at the hospital, such as your nursing staff, any other physicians that may be involved in the care if need be. And so you're communicating to us how you envision your birth. What is it that you absolutely want? Put that on your absolute side of the paper, and then the negotiable sides. Some of the things that really you're going to be needing to do, such as a fetal monitor. We want to see the baseline of the baby's heartbeat. Make sure baby's okay. Then we can take the monitor off you. We also want to look at, does dad want to cut the cord? Do you want delayed cord clamping? There will be times when your birth plan has to change. Those times are pretty much dependent on what's going on with mom and what's going on with baby. Should your pain tolerance be very high, you may need to get an epidural. Should the baby's heartbeat change, and the only thing that we can assess the baby on, because the baby doesn't talk to us and say, I don't feel good, the baby shows us in their movement as well as in their fetal heart rate tracing. So if there's something that we see there that we have to alter the plan, we communicate it together and we alter it together to make a situation that is good for you and good for baby, and we have a good positive outcome with your baby.